All through October, we've been highlighting stories of breast cancer survivors to raise awareness of the disease. And here to give us more on the education and talk about the latest in treatment, Dr. Julian Berrocal with Jupiter Medical Center. Thank you so much for stopping by. It's always important to talk about this.
Pleasure to be here. Thanks for having me.
First, we'll just start off with how common is breast cancer?
Yeah, it's actually quite common for women. Apart from skin cancer, it's the most commonly diagnosed breast cancer. We know that for every 8 women, 1 will have a breast cancer diagnosis at some point in their lifetime. But when it's caught early, I can't emphasize enough, early detection is critical. Patients who have an early detected breast cancer, stage 1, stage 2, they have a great prognosis. They're going to live.
Yeah, so early detection is important. And we talked earlier, we teased a little bit about what it is like for men. How should they know to get screened? Because it's not something that is preached to them to get screening for breast cancer. What signs should they look out for? How common is it with men?
Yeah, so everyone thinks it's a woman's disease, but actually men do get breast cancer. Everyone has breast tissue. For men, what I counsel on is if they feel a mass behind the nipple or the areola, that needs to be investigated. Most commonly, it's just a normal breast tissue, but if it's hard, if it's concerning, if there are skin changes, they should definitely speak with their physician about it and not ignore it, because that could be the sign of a male breast cancer. Okay,
so we're looking at some of the common signs right here on your screen right now. And I asked you earlier, when we talk about genetics, I think this is important to talk about too. You know, if you have a family history of breast cancer, how important is that to relate to your relatives, maybe your children, other people you know of?
Yeah, you want to discuss it. So the American Society of Breast Surgeons put out a statement that anyone with a newly diagnosed breast cancer should consider genetic testing. We know that a specific gene, such as BRCA1 or BRCA1 and 2, that are inherited can be passed on to the next generation. If a patient has genetic testing and they are positive for a mutation, they definitely want to notify their family members, because if they pass that gene on, their family members would be at risk. It can change their screening and it can change how they're followed in the future.
So it's so important to just have an open conversation. A lot of times, some people are ashamed to talk about it, but it's important to talk about it with your family. And talk a little bit about, are there any latest treatments for breast cancer, any new innovations?
Yeah, there's actually a ton. We're moving the needle forward. So from a medical oncology standpoint, some of the medications we have and targeted agents are really good at actually removing and killing the cancer cells, where I go in and do an operation and the pathologist calls me and tells me the chemotherapy took care of it. There's no residual cancer. For that patient, that prognosis is very good. We have intraoperative radiation therapy that's also available now, so patients don't have to go for everyday radiation therapy treatments. They can have it all done at the time of their surgery and be done with the local treatment.
Okay, a lot of innovations there. I'm sure more to come as well.
Absolutely.
Okay, Dr. Julian, thank you so much for being here with Jupiter Medical Center.
Pleasure.
Is there anything else you want to add for our viewers?
Early detection, guys. If you're a woman over the age of 40, bilateral 3D screening mammogram on an annual basis.
Yeah, we can't talk about this enough.
Yeah.
Thank you, doctor, for coming. And if you want to learn more about Breast Cancer Awareness Month, we have extensively done stories about people's stories, their survival stories. Make sure you go to our website, just type in breast cancer.